Bismillahirrahmanirrahim. I am Dr. Shahlla Kanwal, working as consultant obstetrician and gynecologist in Tertiary Care Hospital, Lahore. Today, on the demand of my undergraduate medical students, I'm going to discuss the instrument of dilatation and curettage. I will just name them and just a little bit uses of them. There are you can see here, just show them. You can see that here the whole set of instruments of the dilatation and curettage. I will start with this Speculum. You can see this is single blade Speculum, and you need an assistant for that, and it can retract the posterior vaginal wall. This is the double blade Speculum. You can see it also used for retract the posterior vaginal wall for the dilatation and curettage, and assistance is needed. Now I will show you, this is a metallic catheter to empty the bladder, because in the dilatation and curettage the bladder should be empty. So this metallic catheter along with that of Foley's catheter can also be used. One of them can be used. This is a very important instrument. This is the uterine sound. There are the two types of the sound, bladder and uterine sound. The uterine sound, the difference between the two is the uterine sound has these gradation. You can see here, these are the gradation and the number are written, which will tell us about the size of the uterus. And when we insert in the uterine cavity, we can assess either the uterus is anteverted or uterus is retroverted. By this, we can comment on the version of the uterus as well as on the size of the uterus. The next instrument is tenaculum. Tenaculum is used to hold the anterior lip of the cervix. It is used for non-pregnant uterus when you are going to do for the diagnostic DNCs. This is the valcellum. This is also tooth valcellum, also called the tooth valcellum, and it is used to hold the anterior lip of the cervix. So, for the visualization of the cervix, and can also be used for the pregnant uterus, like for the incomplete miscarriages or the missed miscarriages. There is another speculum I am going to show you. This is the self-retaining duct speculum or cuspo speculum. You can see, you can put it in the posterior vaginal wall. It can retract both anterior and posterior vaginal wall, and you can hold it there, and no assistance is required. There are the different sizes of these speculums. This is for nellipara or the with low parity uterus, and this one is the larger one and the multipara uterus. So depending upon the capacity of the vagina and depending upon the parity, different sizes of this duct speculum as well as the cuspo speculum can be used. Now you can see here, these are the sets of dilatation cannula, like Hager dilators. These Hager dilators are of different sizes, from smaller one to the larger one. This is the smaller one Hager dilator, and this is the larger one. There is an increase in number, and the number are written on these dilators. If I can show you, here is the written the 7 number, and here it is written the 8 number. So when we use these Hager dilator, you have to use the smaller number first according to the capacity, according to the cervix, like it's a nellipara or the multipara, and then you have to use the larger one. You have to use in increasing, like smaller one, then larger one, and then larger one. You have to increase the number gradually. So this is the set of Hager dilators, and or the undergraduate and postgraduate medical students who are doing gynae and obstetrics, they should know about these. And the next one is, this is the curette. You can see that is used to curette the uterine cavity. You can see it has the both two ends. One is the smoother one, and this is the sharper one. The smoother one is used first when you have to curate the uterine walls. You have to use first the smooth one, and the next is the sharper one, so that you can empty the uterine cavity, or you can take the sample for the diagnostic DNCs as well. When you have to explore the uterine cavity for the pregnant uterus, you have to use as well This is the sponge holding forceps. The sponge holding forceps is very important when you have to remove the retained product of conception. This is an other instrument. You can see this only have the single like curettage curetaria, and these are used for the large uteruses. So this is all about all the instruments of dilatation and curettage. You have to, for the undergraduate medical students, you have to know their name, their uses. In the next video, I will show you how you can perform the dilatation and curettage. Thank you so much. Please subscribe my channel.